How do sensory issues affect behavior in autism? Have you ever wondered how sensory issues can shape behavior in individuals with autism spectrum disorder? Sensory processing differences play a significant role in how autistic individuals interact with the world. These differences can lead to being overly sensitive or under-responsive to stimuli like sounds, lights, and textures. When sensory input becomes overwhelming, it can trigger stress or anxiety. This often results in behaviors such as withdrawal, distress, or even meltdowns. A meltdown can be an intense emotional reaction that includes crying, screaming, or aggression. For example, some individuals may cover their ears in response to loud noises or avoid bright lights. Others may seek out specific textures or sensations, which can lead to repetitive movements or self-stimulatory behaviors, commonly known as stimming. These actions often serve as coping mechanisms to manage sensory overload or understimulation. Research indicates that sensory processing challenges are linked to increased behavioral difficulties in autism. For instance, issues with auditory processing can lead to more repetitive behaviors and difficulties in social communication. Similarly, problems with visual and movement processing can affect self-regulation and attention. Touch processing difficulties can also impact how individuals respond to their environment. Understanding these sensory-driven behaviors is essential for effective behavior management. It is important to determine whether certain behaviors stem from sensory issues or other factors. By addressing sensory needs through tailored interventions, such as sensory integration therapy or environmental modifications, parents can help reduce anxiety and emotional dysregulation. Teaching self-management strategies is another effective approach. These strategies can empower individuals to recognize their sensory needs and communicate them effectively. For example, using visual schedules or sensory breaks can help manage overwhelming situations. Recognizing and supporting sensory differences is vital for behavior management and support. When sensory needs are met, individuals are more likely to engage positively with their surroundings. This not only helps in reducing distress but also improves overall functioning and social interactions. In summary, sensory issues significantly affect behavior in individuals with autism spectrum disorder. By understanding these challenges and implementing supportive strategies, parents and caregivers can create a more conducive environment for emotional regulation and positive behavior.